Hello. I will speak about psychiatric disorders in children with limb loss and parental education. The adaptation after amputation is quite challenging, both for the parents and the children. It's too painful, the treatment, and so much disability due to the disease can lead to so many psychiatric disorders. And behavioral and mental issues in company with the physical disease is negatively affecting the compliance to treatment and mobility. The prevalence of psychological problems secondary to chronic diseases vary between 10 to 30%. And it can be adaptation problems to depression and can lead to very severe mental disorders that detach totally from the outer world. And it is mostly because of the sense of the body and also the concept of self. If there is any physical disability and deformity, and in those with physical disability, mood disorder can be observed threefold more when compared to the general population. A reaction against amputation in children and adolescents may vary depending on their conception of their capacity. There are certain steps followed, the cognitive states, just like the different ages, like shock, denial, anger, rage, incrimination, depression, and then followed by acceptance. During the amputation and years after the disease, even there could be so many disorders that may be at onset during adulthood. PTSD, acute stress reaction, attention problems, anxiety disorders, depression, behavioral disorders, learning difficulty. Of course, PTSD is the most common one, and just like the adults, they can also have avoidance and re-experience. They actually can show such reactions. Of course, it is the age that is so important in here. Especially in very small children, the central nervous system organization is not fully developed, so they can be amnesic against they can have amnesias as a result of the trauma. Before the age 3, uh, it is important to build the relation of trust. They learn about their bodily functions. They actually are totally dependent on the caregivers because of the challenges and the pain. And they cannot pretty well understand the severity of the disease at that age. And the babies are affected from the emotional reactions of the parents. And it's important to educate the parents, and we have to help them to cope with the guilt and the fear, which may be the case for them. And the treatment also should help for parents and the infant's attachment. For example, in nursing mothers in particular, it is important for better attachment, and some sleeping and eating disorders could be the case. In 3 to 6 years of age, they started to learn becoming independent from the parents, using symbols and language. And mostly there are some concerns about being abandoned or some physical harm. They're self-centered, and therefore the disease, hospitalization, or painful procedures can be considered as the consequence of the bad behavior. They may have the need to check whether they have lost the parents' love or so. And of course, at this age group, there could be regression in the child due to the amputation challenges. The parents thought that they are actually prevent the exacerbation, so limits the activities of the child. So they could be dependent on the caregivers, their medical doctors, and they could be so passive, and later they can actually show some anger towards them. 7 to 13 years of age, they actually, for example, are much more sensitive about rules, ordering, organization. That's the time that they develop losing control and fear of that. And they can actually have better acceptance, I mean, better understand the disease, but still they think they have this disease because they did something wrong. And they actually can tell you more about their disease and they can more actively participate in the treatment. And during this period of time, as life equals to action and activity, they may feel that it's actually a life-threatening disease, and they have to very clearly speak about the disease. Leaving the family, they have such the fear for the abandoning the family or for foreigners or being, for example, abandoned in an unknown place are the common concerns that they have. But of course, school performance is also affected. Adolescence, it is actually the second separation and individualization. They have peers and there's peer influence, so much body image, and in understanding the amputation, they have a gradual transition to adulthood. Again, it decreases by this age, but still they can feel themselves guilty and responsible for the amputation. The amputation itself is the major problem for adolescents because it is actually the loss of independence and no more plans for the future. They can be introvert and they may not like to go back to school because of the changes in their physical appearance. And of course, there's some restriction of the amputation because they're about to be independent, and if there's control and pressure from the parents, it's problematic. Of course, each adolescent would give a different reaction to the amputation. For example, some of them would totally accept it. On the other case, some others will rebel against it. And depression, agitation is so common. Eating disorders, sleep disorders, and isolation and fear of death can be the other issues that they may experience. Even there is a conflict of dependence, independence in normal developing adults or acceptance, rejection. But after amputation, they most would not like to have any treatment and they do not like to cooperate for treatment. Some parental education as well. Why? Because after amputation decision, it's actually the parents that play a major role. So how we are going to educate the parents is so important. So after amputation, the entire life of the parents changed. The family system theory is saying that in case of any change in health and functionality, it affects all family members. So there's a need for restructuring because there's no more balance. Going to the hospital, multimodality treatment, unknown process, so many issues they have to handle as a parent. And it's mostly desperation, lack of trust in parenting skills, and staying away and from the other children and the family, and about the death of the child. These are the main fears. And there is development of depression so common in mothers because they mostly care for the child. And also the anxiety in the family is also a leading factor for a psychiatric disorder in the child. As a psychiatrist, we have to cooperate and act together with the caregivers. And you have to have due diligence to the parents. In particular, you have to prepare them by assuming their role as the parents. And the temperament, personality of the caregiver is also very important, whether they have an already existing mental or physical disease. And once there's loss of limb and depression, anxiety, PTSD are also so common in such families. Even divorce rates are higher after these types of incidences. So you have to make a psychological evaluation of the caregivers, their coping mechanisms, defense mechanisms, whether they rationalize, and it's important to understand this. And of course, they actually should be in an attitude to cope with all these. I mean, as professionals, we also have to pay attention. We have to let them to cope with this. Working in the clinics with such parents is not an easy task. Once you inform the parents about any disease, even for ADHD, it is actually a minor condition, it's very difficult for them to accept it. Same for the severe condition. So we have to be very delicate in how we approach the parents. And you have to advise the parents to keep their daily routine to the extent possible. But we should never forget about the healthy siblings at home. Because there is the risk of psychological stress. They all have anxiety disorder, depressive disorders, and low self-esteem. And the healthy sibling is actually mad at the sick sibling. There is jealousy. They assume more responsibility. And therefore, support groups can well be used for the other sibling. For example, grandparents, teachers, friends, siblings, and other relatives who may assist during the treatment should be identified. And while the parents are dealing with the amputated children, for example, they can pay attention to who will be in charge of the other sibling. As I told you, we should always keep the other sibling in mind all the time. So that's all. Thank you.